Hey everyone, welcome back to the channel. Today we are talking about something that affects millions of people around the world: psoriasis. So what exactly is psoriasis? Psoriasis is a chronic autoimmune skin condition. That means the immune system becomes overactive and speeds up the growth cycle of skin cells. Normally, skin cells grow and shed over about a month. But with psoriasis, the body can produce new skin cells in just a few days. Because the body can't shed those cells fast enough, they pile up on the surface of the skin. This creates thick patches, redness, scaling, dryness, cracking, itching, sometimes pain. Psoriasis is not contagious. You cannot catch it by touching someone. That's one of the biggest myths out there. Psoriasis can appear anywhere on the body, including scalp, elbows, knees, lower back, hands, feet, nails, face, skin folds. For some people it's mild. For others it can be severe and affect everyday life. Researchers believe psoriasis develops from a combination of genetics, immune system dysfunction, environmental triggers. If someone in your family has psoriasis, your chances may be higher. But having the genes doesn't always mean you'll develop it. Sometimes a trigger activates the condition. And we'll talk about those triggers later in the video. Types of psoriasis. There isn't just one kind of psoriasis. There are several different types. Let's go through the most common ones. 1. Plaque psoriasis. This is the most common type. It causes raised, red patches covered with silvery white scales. These plaques often appear on elbows, knees, scalp, lower back. The patches may itch, burn, or crack. 2. Scalp psoriasis. This affects the scalp and may look similar to dandruff. Symptoms include flaking, itching, dry scalp, thick scales, bleeding from scratching. Sometimes it extends beyond the hairline. 3. Gut-tape psoriasis. This type appears as small drop-shaped spots. It often develops after infections like strep throat. Inverse psoriasis. Inverse psoriasis appears in skin folds like armpits, groin, under breasts, between skin folds. Instead of thick scales, the skin may look smooth, shiny, and bright red. Heat and sweating often worsen symptoms. Pustular psoriasis. This less common form causes pus-filled blisters. It may affect small areas like the hands and feet or larger areas of the body. Erythrodermic psoriasis. This is rare but serious. Large areas of skin become extremely red, inflamed, and peeling. This can be dangerous and requires urgent medical attention. Nail psoriasis. Psoriasis can also affect fingernails and toenails. Signs include pitting, crumbling, thickening, yellowing, nail separation. Some people with psoriasis also develop psoriatic arthritis. This affects the joints and can cause pain, stiffness, swelling, difficulty moving. If you experience joint symptoms, talk to a healthcare professional early. Common triggers. One of the hardest parts of psoriasis is dealing with flare-ups. Symptoms may improve for weeks or months and then suddenly return. Different people have different trigger. Stress is one of the biggest triggers. Many people notice flare-ups during emotional stress, anxiety, or lack of sleep. Unfortunately, psoriasis itself can also create stress. Skin injuries. Cuts, burns, scratches, tattoos, and insect bites may trigger psoriasis in certain areas. This is known as the Koebner phenomenon. Infections. Illnesses like strep throat are strongly linked to gut-tape psoriasis. Other infections may also worsen symptoms. Cold weather. Dry winter air often makes psoriasis worse. Some people improve during warm, humid weather. Smoking and alcohol. Smoking and heavy drinking may increase both flare-ups and severity. Certain medications. Some medicines may trigger psoriasis in certain people. Examples include lithium, some blood pressure medications, certain antimalarial drugs. Never stop medication without medical advice. Diet. Diet affects people differently. Some individuals report improvement after reducing sugar, processed foods, fast food, alcohol. Others may not notice major changes. There is no single diet that cures psoriasis. Topical treatments, applied on skin. Used for mild to moderate psoriasis. Corticosteroid creams. Vitamin D creams. Salicylic acid. Coal tar products. Moisturizers and medicated shampoos. Light therapy, phototherapy. Controlled ultraviolet light treatment, under medical supervision. UVB therapy. PUVA therapy. Laser therapy for small areas. Oral medicines. Used for moderate to severe psoriasis. Methotrexate. Cyclosporine. Acitretin. These require medical monitoring because of possible side effects. Psoriasis is a long-term condition, but with right knowledge support treatment plan many people can manage it successfully and live healthy confident life. Disclaimer. This content is for educational purpose only and doesn't replace professional medical life. Thank you for watching.